Thank you, everybody, for coming today. We're really excited as a steering committee to have the Hawaii folks on with us today to share their new Hawaii Water Safety Action Plan. We have three individuals who have joined us today from Hawaii: Allison Schaefers, who is the lead writer; Jessamy Horner, who is the co-founder of the Hawaii Water Safety Coalition; and Sarah Fairchild, who is also a co-founder of the coalition. So we're excited to have the three of them with us today to share their experiences in the development of their plan. Megan, did you want to say anything before we let them introduce themselves?
No, just a quick thank you for joining us, especially at this very early hour for you all. And so grateful for your leadership in this space. Everyone in the drowning prevention and water safety awareness space is so excited by the work you've done and so inspired by it. So you've really set a nice course here for the rest of us to follow. So very much looking forward to your presentation, and I'm sure we'll have some time for some Q&A at the end.
We'll let you all take it from here.
Okay, Jessie, do you want to introduce yourself first?
Sure, I'm Jessamy Horner, and I'm the co-founder of the Hawaii Water Safety Coalition. I'm also a bereaved family advocate. I lost my husband, Mark, and my daughter, Mina, over 8 years ago at the Makapu tide pools during a rogue wave set from an offshore storm. And I'm just really grateful to be sharing community here with you all on this journey and to share our plan.
Okay, well, I'll introduce myself. I'm Allison Schaefers. I was the lead writer of the Hawaii Water Safety Plan. I'm also a bereaved parent volunteer for the Hawaii Water Safety Coalition. I lost my daughter, Charlotte, Sharky Schaefers, aged 5, in a retention and detention pond tragedy. Her friend was in the pond struggling, and she's the secondary drowning. She jumped in to rescue him. She was able to push him out, but she drowned in the pond. And the pond was improperly flooded. The pipe in it was 89% clogged. So that's become a priority, I think, nationwide, safety around retention and detention ponds. And we have a bill that we're advocating for in Hawaii this year as part of our recommendations in the water safety plan. Thank you.
I'm Sarah Fairchild. I'm the executive director of the Outrigger Dukanemoku Foundation, which is a Hawaii local foundation which typically raises money for water sports and volleyball to perpetuate the legacy of the native Hawaiian Olympic swimmer Dukanemoku. But in my work with the foundation, I was increasingly seeing how important water safety was. We were seeing lots of kids didn't know how to swim or weren't progressing through the ranks. And it just got me to thinking. At the same time, during COVID, as everything slowed down, I just realized that through the foundation, had connected with all these different water sports groups and also lifeguard groups and to learn to swim groups, lots of groups in water safety, and thought so many were doing great things, but we weren't all necessarily connecting, and especially they weren't connecting with each other. And then Hawaii being an island state, things that causes a little more disconnection, especially when people aren't getting to travel as much during COVID. And I had this idea, which I didn't act on for a while, that we should get everyone together. And then as COVID started really ending, I started talking about this idea a little more of like, we should really get everyone together in a Zoom or a group meeting and see how we could get groups to collaborate. And I had one or two people that thought, yeah, that'd be a good idea. But still, it just didn't really get energized. And then meanwhile, I had been working on getting a bill passed for a Duke Kahanamoku license plate. And a former board member had come up with the idea that it should raise money for water safety. And the first year we had the bill in our legislature, I didn't even realize I had to do anything in terms of lobbying, and the bill didn't go anywhere. And so the next year I started some research, and I found out, yeah, kids not only were not learning to swim, but that we were second in the nation for resident drowning. And that really just didn't match this waterman culture that the Duke Hanamoku Foundation is trying to perpetuate. I shortly thereafter found out that kids in Hawaii, for kids in Hawaii ages 1 to 15, drowning is the leading cause of death. And I was just really alarmed by the statistics. So started again talking to people, and somehow met Jessy, and we started talking about maybe we could get this group going. And she had already been in contact with the chief of ocean safety in Honolulu at the time. So the three of us had a meeting, and we started talking about maybe we could do a conference, get everyone together. Shortly thereafter, we found out there was another group that was also kind of thinking about a conference, that we knew some of the people. So we joined forces and started a bigger conference idea. And meanwhile, I'm getting more and more excited about this idea of a coalition. I'm not sure if at the time I had even heard of the California Coalition. But I just started, every time I was in a conversation with a new person that had anything to do with, well, really anything to do in my business life, I just started talking about the coalition. And I don't remember how I met Allison, like why the connection, but in her professional life, she's an investigative journalist in Waikiki, and that's where the foundation was formed. So somehow I ended up on the call with her about something else. I had no idea that she was a bereaved parent. And I started talking about the coalition, and the whole conversation just changed. And she was like, oh, well, I might be interested in this. And thank goodness, because she's been such a key part in writing this plan. So I say that to say, as everyone is out there thinking about how they're going to write the plan, my advice would be just talk about the idea. Everyone you meet, you don't know what kind of resource they might be, and you're going to need a lot of people to help. It's a big effort. We'll get into a little more about like what kind of roles to look for later, but I would say just get excited about it and bring in as many people as you can. So from there, we're going to do a quick run through of the plan that we wrote. We're not going to go to every detail, but just so you have an idea, Allison and I are going to just tell you about the pieces of it. Let me share my screen. So this is an overview of the plan. And we were fortunate at the end to, well, not at the end, but after we were a good way into it, we were fortunate to, again, be talking about the Salatsa groups, and found a local graphic design group called DTL that was willing to work on the graphic design, and more importantly for us, really work on some advising on making sure it was culturally appropriate for Hawaii. So they did all this graphic design. We started with acknowledgements. We went over this many times. I would, in terms of like writing your plan, I'm just going to try to think of things that were helpful to us. But Allison, again, we were so fortunate to find her because she's an investigative journalist and was used to writing professionally for things that would get published. Well, I write a lot. I think I'm a decent writer. That is not my background. And she had us go through this thing probably 100 times. We've gone through it. So checking names, rechecking dates, double checking, triple checking everything. table of contents, which is also linked to each section digitally. And then right away, some of our drowning statistics are most crucial. And for us, another big deal in Hawaii was simultaneously, this young man named John Calais Clark had done some research for his public health thesis, finding that Native Hawaiians and Pacific Islanders make up 27% of our population, but represent 36% of our drownings. And again, we were able to find him because well, I don't know if the other women knew him already, but I knew him because he had been a scholarship recipient for the foundation. And actually the original way I met him was he was on the UH swim team and had received a grant. And then it turns out he is a relative of Duke Kahanamoku. So someone else had made sure that I was introduced to him, and he's just a great person. I don't know if he's on the call, but it just really felt meant to be that he was the person that found these statistics, and we were able to bring them into the plan. Allison, did you want to say anything about the executive summary?
So one of the things that we really tried to do in this plan was to make it very relatable to Hawaii. So even with the executive summary, it really just kind of focuses on, like the rest of the plan, Hawaii, what is important to Hawaii. We wanted it to resonate and inspire, and not just be completely data driven. So even at the executive summary level, I brought in the culture of Hawaii, which is very different. It's a very unique and special place. And so I thought the plan should reflect that, and that it would be more well received if it did. So a lot of it, water in Hawaii is really considered wealth. And so a lot of it focuses on the fact that water being so important to Hawaii and the Hawaiian and Pacific Islander cultures, but that we'd lost our way, and that, that we have the best watermen and waterwomen in the world, but somehow that culture was no longer getting passed down. And so I looked, as I wrote all of this, I looked for ways to make this focused on our audience, which was Hawaii.
And I just wanted to point out, this picture kind of happened while we were writing the plan. That original license plate bill that I mentioned and a May 15th Water Safety Awareness Day bill were both signed by our governor. That's Allison right next to him. And these people, a lot of them are in, well, all of them are in our coalition, but some of them had worked very heavily on us.
Allison, and Sarah, I just wanted to throw in there too that we talk about why and kai. Why is freshwater, kai is saltwater. And in Hawaii, of course, we have some of the most incredible lifeguards, ocean safety lifeguards in the world. We put tremendous resources towards, what they do on the beach every day to rescue and prevent people from drowning. But in looking at the national plan, when I was researching the big picture, my approach has always been that we needed an interagency approach, but I also noticed in the national plan that there was so much more emphasis on just drowning prevention in any aquatic environment. And so we did a major reframe in our community to include why, which is freshwater as well. So we can talk about that more later too.
Yeah, I'm just riffing off of Jesse. One of the things that I hear about often, and I correct people, is that they feel like Hawaii's high drowning rates are due to our visitor deaths, and that are due to ocean. And they're really shocked when they find out that visitor deaths really don't. Visitors die more often in the ocean than residents, but our resident population also has a terribly high statistic. And that a lot of it's for small children, it's other aquatic environments, not the ocean. You know, everything from pools and retention and detention ponds, like what my daughter died in, to puddles. I mean, so in bathtubs. And so we're hoping to kind of reframe that conversation and get the word out that, you know, because otherwise with the ocean, I think the feeling is, oh, well, people just need to learn to respect the ocean, and that it's not about the fact that our kids in Hawaii can't swim.
So as you can tell, we did a lot of, at this point, as we started the plan, we were doing a ton of background research, looking at other plans for design ideas, layout ideas, and of course, the US National Water Safety Plan, by now we had found out was coming out, and it came out right as we really got into organized writing, I'd say. So then we gave a little bit of the history, and this document for us has really become something that it has so much in it. But as I told a group recently, it can be used so that some of our water people that have been doing drowning prevention for 30, 40 years, like, they know the history, but they can also use this document to give to someone in a different industry that's coming in to help them, to get funding, or even a young person that's just starting out in drowning prevention. They could read this and kind of get up to speed about where we are. Allison, do you want to talk about this?
So, I mean, that's culturally, we want it. I told DTL that I wanted to bring in aspects of storytelling from Hawaiian culture about respect for the water and that tie-in. So this is one of the passages that they contributed, telling me that, you know, native fishermen, and then the early Hawaiian surfers, and what lessons can they tell us that relate to water safety? I mean, in Hawaii, there's a feeling that it all goes back to that we're all connected, you know, to the past. The past is sort of, in many ways in Hawaii, the present. And so here it's very important to bring in those cultural and historic elements.
I wanted to add to that piece with the mo'olelo. So mo'olelo is a story that is culturally rooted, and certainly in my family's case, the location that Mark and Mina were at in a tide pool area, there's changeable conditions. You know, you have to know the history of how a place behaves to really understand how to be safe. And the meaning of that mo'olelo with the fishermen being able to go out and provide for their families is because they had such deep knowledge of the ocean, tides, location. And so I think the deeper takeaway from that story is to not try to restrict people's access to water, but to make sure that they have the awareness of how to approach a place, any aquatic environment. And when, you know, that cultural knowledge has elements to it that can help keep us safe.
Allison, did you have any more comment about the values?
Yeah, so this is one of the first things that I worked on, actually, when I set out to do the plan and try to figure out a structure. First, Sarah, I had her outline basically some of the what could be found in the national plan, and and then I took the national plan and the California plan and the New Zealand plan and the Australia plan, and I looked for what was the commonalities that were needed in our plan. And then one of the first things I wrote were these values. In Hawaii, everything is framed by our values. And if you really want to affect change, it needs to tie back into the things that are most important to us, our values. And so how do our values relate to water safety? And that was a very early conversation. And then I had, I talked with the Hawaiian cultural advisors that we had with DTL to try to make sure that these were correct as well. And then they had suggested adding an additional value in Malama, which is to care for each other, which, really is a lot at the core of this. And Pono means doing the right thing in Hawaii. Kako means that we do these things together. Lalima is the value of cooperation, that, many hands make light work. Kuleana is taking personal responsibility and accountability. And our kahea it's like a call to action in Hawaii. And, we wanted to make sure that in every aspect of this document, it wasn't meant to be scolding people for the things that we haven't done well. It was meant to inspire us to do better.
Allison, could you talk a little bit about the statistic piece?
Yeah, well, I mean, what I would encourage anybody to do that's writing a plan, I think one of the strengths of our plan is it's very data driven, but it doesn't feel like that. So I relied heavily, and it's good. I have a print background, so I work in newspapers. And my husband is also a graphic designer and had worked in newspapers and throughout. And then we had the DTL people to advise. So I worked with them on all of these graphics, trying to make them more readable. And then just trying to also, and then I went back to the Department of Health and I would talk about, okay, I would like to say this instead. Is this still correct in the data? Like for instance, just calling, we had, residents, okay, that's fine. But then we had non-residents and I said, non-residents, can we just call them visitors? And it was agreed we could call them visitors because lay people, non-residents isn't, they think of people in Hawaii as either residents or visitors, not non-residents, because what the heck is that? And then just simple things like I remember calling Dr. Glennis, who is and was such a big part of this plan for the Department of Health. And I'm like, John, can we just use the word, so he had the word decedent in the graphics initially with it. And I said, can we just call those people dead people? Do we have to use the word decedent? So I worked really hard to make these more readable for lay people because otherwise, this is about outreach and it needs to be something that everybody can understand, just not just the scientists or the water safety experts in your groups.
Then this is the piece that I alluded to earlier about drowning rates among Native Hawaiians. We really made this a pretty significant section, so that could also be a pullout for other usage. Like you literally could pull out these couple pages as their own PDF. Did you want to say anything more about this piece, Allison?
Yeah, just that I thought, it was very important locally to have that resonate. Drowning worldwide is an equity issue, and that's certainly just as true in Hawaii, maybe even more so. If you look at Native Hawaiians and Pacific Islanders, they're often left behind in other things too. I think though, they're left behind in terms of like they had higher COVID rates because of the multi-generational living and different things like that. But in this case, getting left behind in the area where you're known worldwide to excel in was particularly tragic. And we recently presented this plan at a visitor public safety conference. And that also has gotten us a lot of support from the visitor industry as well. But the thing that really resonated in the visitor industry wasn't even the visitor statistics. They want to work on those, but it was the Native Hawaiian Pacific Islander statistics because especially with this advent of what you call destination stewardship in tourism management, there's really a focus on trying to make sure that destinations are appealing for locals first, and then if they are, they'll be great for visitors. But one of the things they asked at the public safety conference after we had presented, they asked people to raise their hands if they learned to swim by being thrown into the water. And it was like 75% of the room. So, and then there were other people there that told us they have canoe clubs, paddling clubs, and that typically, a good portion of the kids that come to take paddling club don't know how to swim. So they have to swim first. And so learn how to swim first. So I think that, like many things in Hawaii, when you get to the core of Hawaii, our Native Hawaiian Pacific Islander population, they can lead you to get to the rest of the population, because if it's good for Native Hawaiians and Pacific Islanders in Hawaii, it's good for all of us.
Okay, I'm going to kind of just quickly touch on the rest so we can have time to tell you a few more things about our process. This is Calais, who I mentioned, found all that data and pulled it together. And then we had a few of these case studies throughout the plan to kind of break it up and make it more interesting. We did not feature every nonprofit in our state, but we just tried to highlight some local nonprofits that were working on a very specific thing and then not repeat that same thing. So for instance, this one is about, as it sounds, free dive safety. And then we went into our strengths, historically featured our lifeguards, and really tried to we did work with each county lifeguard chief. They wrote these sections and they double checked them. Further studies about some of the projects they've worked on, our water safety community, like public access rescue tubes, which has been a big project here. And then our challenges, which probably match many other parts of the country. And I'm just trying to save time. We touched on climate change. We're really just trying to set up for all of our recommendations that we had really done this research and surveyed the community before we just started listing all the recommendations. We also worked heavily with our local Department of Health on these hotspots and black spots maps, which they had actually already created the hotspots map. But we just thought it's obviously so visual. But we used the hotspots would be where drownings were occurring, and then the black spots were from the county ocean safety lifeguard chiefs telling us where people were likely to get into trouble. May not just be drownings, might be injuries, might be a place that's on social media that's attracting a lot of people that didn't used to. And then we got into, the most action-oriented part, which is our recommendation for our state. And again, I'm not going to go through every one, but we did group them. This took some time to figure out how they should be grouped. We really talked it through a lot, redid it a couple times. And then we decided to actually put the national plan recommendations in as well, because we thought people aren't probably, if they're taking the time to read this, they may not take the time to go find the national plan and read that as well. And we didn't just copy everything in the national plan. We really tried to do things that were important here. And then finally, we dedicated this last section to Sharky, who's Allison's daughter, and Mark and Mina, Jesse's family, and Alex and Duke, who are Shirley DeRigo's kids, that Shirley is also very much part of the coalition. And Jesse, if you don't mind, would you mind sharing that thing you said about love letters?
Sure. We had our plan launch at the state capitol, and I was reflecting on what was the main thing that I wanted to convey. And I think it's really the spirit behind the plan, and a turning point for me in this 8-year process was finally connecting with other bereaved parents in other states and nationally. Shazek Sunoda, No More Under, was really a huge support in pointing me in the right direction. Seeing the work that Zach Foundation is doing, Collins Hope, also meeting people that have worked with bereaved advocates like Alyssa Megram. Just it was like the emotional sustenance that I needed to keep going, because there's so many barriers to elevating this to the leadership level. And so when we shared the plan at the Capitol, I just wanted to share that this plan really is a love letter to those that we have lost. And it's also a love letter to our community because we do not want this to happen to any other families. And I know that, we always say drowning is preventable. Being in the injury prevention space, I'm actually working very closely with the Department of Health. To me, is like a sacred space. We look at the data and we know what the future is unless we come together and we make interventions. And my goal has always been to try to elevate this to the statewide level so we can see an impact in reducing our data. I had a choice early on. Did I just want to do some direct programming work? And there's some amazing organizations like Shirley Durago with Alex Durago Foundation, Nakama Kai. We need to have those people out interfacing with the public, but I just could see that there was such a missing puzzle piece with having the conversation with our leadership. So that's how this plan is a love letter. And this Olelo no Iao Hele Poina Ole Kekeki is Ele, never forgotten, is the beloved child. And that's, the spirit of our loved ones are here in this process. And I've spoken to a lot of other bereaved families that this work is very hard to do and they can't do it. So I'm in this space doing it for them. Allison's in this space doing it for them. And I also just really appreciate working closely with Allison on this as another bereaved parent locally.
Thanks, Jessie. So Allison, could you tell everyone about our process and where we are now?
Sure. So I think I touched on it before, but we really drew on expertise from other plans and then looked on how to get a Hawaii voice for it and what would be culturally appropriate and what would resonate with our community. And then, so with my background in journalism and such, we planned a launch that for maximum impact to get as much publicity as possible. So we had a press conference at the state capitol to introduce the plan. And at that same time, we introduced two priorities from the plan. We have two bills in the state legislature. One is to create a safety, to require safety requirements around retention and detention ponds and to establish a monitoring and inspection program. And we also have another bill for in-school lessons to do a pilot. And so we were able to get a lot of media coverage around that. We've had many stories in different publications. I've been on some talk shows to introduce it and all those types of things. Early on in the process, after we completed the plan and talked about the strategy, we did a one-page talking sheet that I wrote just based on kind of a quick synopsis of the plan. It's front and back, and it has 8 priorities that we looked at for this year. We tackled 2 of them in the ledge. The goal is to keep tackling those priorities legislatively every year until we get them done. And then we're also encouraging different groups to use the plan for their own benefit. And one of the things that was so great is, and during one of the TV interviews, I heard Naka Nathaniel, who he's part of a TV talk show, and he was talking about he's also a journalist in Hawaii, talking about taking the plan back to the canoe clubs so that they could figure out what in the plan they could do. So, kind of harnessing that grassroots approach to getting more help, getting more membership. We also at the same time stood up a website. I'm still writing content for that with DTL. Yeah, so we're just going to keep going.
Great. And Jessie, could you talk about what we did to initially get people to the table?
Yeah, so in my case, I started with the people that were directly involved in the incident with my family, which was, I just had this intuitive sense to reach out to the lifeguards. And even though my family was living in California at the time, I'm born and raised in Hawaii. Hawaii is very relationship based, and I was able to speak to lifeguards that were actually present with Mark and Mina in the, attempted rescue and recovery. And what struck me was just how profoundly they were impacted by it. And I realized that, as a bereaved family, lifeguards are also experiencing and seeing this and witnessing it. And so they have just that natural wish to also support prevention. So I started there, and that's how we connected with the former chief of ocean safety. And then from there, I started to see the need to move beyond just ocean safety, but into areas of other aquatic injury and drowning prevention. And that's when I started connecting with other bereaved family advocates and on the national level. And as far as getting people to the table here, it was, for me at least, I feel like the first person really getting this going. It was years of conversations. And then finally finding Sarah, where I felt like she was the first person who got it and had an established organization that could really align and take this on. And then learning other strategic points to bring people in, like the Keiki Injury Prevention Coalition, which was the first nonprofit sponsor for the coalition with a seed grant, because they were already doing injury prevention work. They were embedded in the children's hospital. So I would say, for coalitions just starting out, that finding those natural allies, your bereaved family advocates, and then also reach out to the injury prevention groups at the hospitals as well, because that's how we started to really gain traction.
I want to talk a little bit about the hurdles that you might encounter that have been difficulties for us, but maybe this will help. One thing when we were brainstorming about this, we were like, well, what's been the hardest part? And I thought, well, this just took so much more work than I expected. Again, I like writing and I do writing, but it was hundreds of hours for Allison, and then Jesse and I, probably at least 100 hours, maybe more. But it's, at least if you're going to produce a plan, something along what we did, expect it to be a lot of work. I think, Allison, was it like a year overall that you were really working on it, or how many months? Yeah.
Yeah, I mean, I really started kind of after that conference, and then we had a meeting and I had you outline stuff and then started from there. But yeah, just between May and October, and then I stopped counting, I had more than 500 hours in the plan.
Yeah. And so I don't say that to discourage anyone, but just know it is going to be a lot of your time. I think Allison didn't have any other time for hobbies or anything in the thick months that she was working on this. But it's worth it. You can do it. And I would highly advise to get people in the inner circle that are writers and that can be self-starters because of that writing time. And then another piece, which is probably true for every state, but it's just coordinating the different agencies and kind of just trying to understand the bureaucracy of county versus city versus private, and then the foundations and other nonprofits, how they're all working or not working together, and figuring out how to change that and suggest things, and just keep suggesting them. Allison, did you already touch on our next steps, you think, or did you want to say anything more about that?
I think I probably touched on those.
And then to kind of expand on, actually, I think I've already.
Well, actually, Sarah, the one thing that I didn't touch on is outreach, and we're still working to do, a couple things actually. So as a trained journalist and someone that's a media professional, it's important to have milestones and linchpins that you can get more coverage. So a couple of the things with Water Safety Day on May 15th, that's a great time to elevate the conversation again and roll out some different partnerships. One of the things that we're talking about is in the visitor industry, we have a hotelier who's willing to let us use their pool and to teach their employees and their children how to swim and visitors. So we're going to do classes there. We have another organization called the Aloha Ambassadors. They're in Waikiki, which is like Grand Central for the tourism industry. And they're greeters and they also do public safety, but they're willing to pass out water watcher cards to visitors with family members. And then the Hawaiian Lifeguard Association has a number of residential and visitor geared programming, and they're planning to do that throughout the state then. And we have other organizations who are joining in on that May 15th endeavor. Another thing that we're planning to participate in the Hawaii Lodging and Tourism Association's Visitor Charity Walk. We participated in their trade show at the Capitol. So any type of it's about relationship building, and any type of opportunity like that, we've been taking it. We've been on the Kukua Council, which is for our seniors in Hawaii. Seniors have more time for advocacy a lot of times, and just in doing that, they've been writing in and supporting our bills. And then we have something called the neighborhood boards. And so we went to the Waikiki neighborhood board and presented. So yeah, we're doing all of those types of things to keep the conversation going. And can you tell about the outreach campaign at the Department of Health, Jesse? So we're also working on outreach campaigns just for educational messaging.
So yes, I definitely want to talk about the Department of Health. When I first started, I joined an advisory committee that was in existence for aquatic injury and drowning prevention. It was, somewhat closed interagency based, but I was able to participate and, be involved at a certain level, but it did pause during COVID. And then it was not restarted. Their drowning prevention coordinator left. And so it took a couple of years of actually pushing on them to restart the committee. And I'm actually currently working with the Department of Health on the committee and in prevention outreach. And, I think it can take a long time, but they're absolutely a critical partner. And now that I have those relationships established, Dr. Galanis helped us with the data. Someone asked in the chat about getting the drowning data. They are the ones that are gathering it, and absolutely critical in helping us to really get our marching orders for where we need to go next. And the most critical piece that has been missing is, we always want to go upstream in injury prevention, is to reaching out to parents, especially of young children, about how to properly supervise. So just this year, the Department of Health has allocated at least $300,000 for an under fives campaign, and we're thrilled to be working on that. And I am reaching out to people like Alyssa Megram and others, looking at other campaigns like NDPA, Zach Foundation, Pool Safely, for best practices and how to walk that out. And we're going to be doing some water watcher cards that have translations for, the language groups that are spoken in Hawaii, some visuals in case people are not reading, and, that are just easy to understand, very simple.
So we're wrapping up about our presentation, but just my advice to other groups would be to figure out early on what roles you need and who has those strengths. We had started where we wrote an outline, and then we tried to figure out people in the community that knew about each piece. And we thought, okay, great, we'll just send this all out to them and they will write their section and then send it to us, and we'll just wrap it all up and it'll be great. But that didn't work. People are busy. Some people are writers, some people are not. I think even in a perfect world, if they had all sent it in, it would have all been written different voice. And so it would have been rewritten anyway. So Allison ended up doing a lot of this, and we helped her where we could, but where she didn't hear back from people, she would go to where whatever level they wanted. You know, they could answer bullet points and send it to her. She could call and interview them. But just know that you'll have to reach people different ways. Also figuring out what rules, as you can kind of hear, Allison knew a lot about PR as well as the writing and research piece. Jesse had made all these connections and understood different parts of the government. I had these nonprofit pieces, and of course there were others that helped us as well. But I would also recommend having one lead writer, and we didn't figure that out right away either, but we realized if we have too many writers, it's not going to sound cohesive. So you have one lead writer who really controls the style and the voice of the whole thing. Jesse, did you have any other things to add about advice?
Yeah, I think we mentioned briefly the first conference. That was also a turning point to just gather everybody together face to face. And we had myself, Allison, and Shirley Durego speak as bereaved parents about the impact of drowning. In my share, I talk about the impact, you know, on the first responders, on the EMS, on the physicians, on the community. We just see that those circles of impact are so profound. And I think we're all starting to understand the mental health, you know, just the effects of that long term on everybody and the social cost. And we did get feedback that was very moving for lifeguards to hear that and to hear from us. And then also just the relationships that were able to be built and in aligning. One thing I did find when I first started out is among the nonprofits in this space, sometimes there's a perceived, you know, there's this idea that they're in competition for limited funds, but really I've tried to elevate the conversation to say the more we come together, the more awareness we have of the issue, the more resources we can gather. And I have been in conversation with some of the national, you know, the CDC Foundation, which of course right now is limited in the conversations they can have, you know, looking at Pool Safely to see if we can qualify for that grant. That's another thing that I'm walking forward is the International Spa and Pool Safely Code to especially try to get those four-sided fencing requirements in Hawaii. So yes, I think integrating the national and other state best practices and bringing them back home to Hawaii gave us perspective of what is possible.
Just to end, I don't know if we made it clear, but the way that we got all of these recommendations was we had a conference in 2023 where we asked everyone attending from all over the water safety community to submit ideas about what we could do to help prevent drownings. And at that time, we weren't even really writing the plan yet, but we saved this list. And then by the next year, we had the conference and we had drafted a lot of the plan. We had surveyed all of the people in the community that we knew for ideas. And then we presented a draft, just like Word doc of the plan at the conference. And then asked people there to take the time to read through at least the recommendations and change, add, edit, and submit them publicly. And I also did a big campaign email about it, and we did a social media post about it and try to get more input for a period. And then we took all of those and tried to edit those down more. And then as we got towards the final stage of the final version of the plan, we again took some pieces, including any of the recommendations we weren't sure about, you know, that we had any question about or we thought might be we thought there might be two sides and it might cause a rupture. We brought those to experts that we thought knew more about it. And we did remove a few. And this, I think that idea came, we also talked to Will Kuhn earlier in the process, and he was one of the lead people on the California plan, which was already done when we were starting. And he had told us to, he had told us for him in California, he didn't want to create any rifts when he was trying to get everyone together. And he just gave us that advice that, like, if something is too, what's the word, too disputed in any way, it may not be worth including right now, because your whole goal is to try to get things done, not just create more fights. So I think that's it. We can take some questions if anyone has any questions.
I just want to add one more point, that this is a living document, even though it's beautifully designed and printed, and the bound version is wonderful to hold in your hands. It is absolutely a living document. And so we do have a website that we're hoping to build out to include the nonprofits, resources, and things like that.
Thank you, Jessamy.
I was just going to say, I saw somebody had asked about drowning data, and Jesse had answered that the data that we gathered was from the Department of Health. I just wanted to say, as a journalist, so we have relationships within the Department of Health. We were lucky for that. But drowning statistics are public record, so anybody should be able to get those from their own Department of Health as well, even if you don't have the relationships. But I would encourage you to have the relationships, because I use those to interpret the data in ways that were more user-friendly for our readers too.
One last point about that, since I've been working closely with them, to take your marching orders from the data can be a complex process. So really, we just had an inquiry about what zip codes we're seeing child deaths in. And so there's this tension between the urban areas where you might see more because there's more people, and some of the other remote locations, but that have a high rate of drowning. And I asked, our epidemiologist, well, what do you do? And he said his recommendation, and I think this is so accurate and just intuitively, is to go with the programs in the areas where you can make impact. So, with some of the Big Island locations, we want to work with the Alex and Duke Dorrego Foundation, the Hawaiian Lifeguard Association, who is our current, we're housed under, the coalition is now housed under them this year, has some outreach campaigns that we hope to, encourage to have that direct reach to those high impact areas.
Thank you for that. That's so important to think about things through that lens. Mariko, I noticed you've had your hand raised for a few minutes. I wanted to just give you the chance to ask your question.
Hi, my name is Mariko, and I work with for the CDC Foundation in understanding and strengthening drowning on our data side of the project, and I'm also the California Department of Public Health field employee. So it's really exciting to hear what other states are doing. My question was about sort of the infrastructural role and design of Native Hawaiian and Indigenous engagement across this project. I know I saw that on the plan there were several phases at which sort of Indigenous consultation was incorporated, and of course there's this section about drowning in Native Hawaiian communities, and this sort of recognition of incorporating Native Hawaiian language, culture and history into the plan, all of which I think are really necessary and important. But I was really curious about who on your core team and your leadership team is actually Native Hawaiian, and how is that potentially impacting even some of the language that I've heard across this webinar, right? Like the phrase that, Native Hawaiian folks are being left behind, as opposed to the reality of being denied actively access to traditional waterways and knowledge. The idea that you're translating, Water Watcher programming into Native Hawaiian languages, but is there consultation with Native Hawaiian folks to make sure that even the main messages and the stories that you're using as educational material are landing and relevant and resonant with folks in these communities? And, you've mentioned New Zealand, you've mentioned Australia. That is like a of tension that I would say fundamentally has not been resolved with water safety, even in those countries who are sort of at the top of the line. So I would just be curious about sort of, yeah, like what does that look like structurally, or what are you hoping to achieve in terms of centering the voices of the folks that are impacted most by this issue?
Sure, I could jump in. So DTL is actually a Native Hawaiian based outreach and PR and graphic design firm. So they are all Native Hawaiian. The one of the owners of DTL is married to one of our Hawaii Water Safety Coalition members. So that was how we kind of got that relationship. They've also experienced loss. So from the destination stewardship side as well, within the Hawaii Tourism Authority, I also worked with their destination stewardship people who are Native Hawaiian. So I did discuss these things with their cultural advisors, again, Native Hawaiian. We have Native Hawaiian membership within our Hawaii Safety Coalition set as well that we could vet some of these things through. But like DTL, I think was probably the biggest strength just for the final vetting. And they're used throughout Hawaii to make sure things are Pono. They're all 100% Native Hawaiian in terms of, and so almost any group that's really concerned about cultural sensitivity often will bring them in as a consultant, and they can outreach within the community. Now, I will say this, and I feel very strongly about this. We felt like there's an urgency because of Hawaii's dramatically high drowning rates to get something out here now. We've had discussions, and one of the objectives in this plan is actually to do a 2.0 version, but it would take, significant funding, and to go out and do a community-based version within our communities. There's something that they've done within the Hawaii Tourism Authority and their strategic planning. They call it the Destination Management Action Plans, and it's actually community-driven. They go out, they get communities throughout the state, they do surveys, and they come up with a plan based on that. We felt strongly that we weren't able at this moment to do that level of community-based interaction and get a plan out, and we didn't have any funds either. We got some donations from the Doris Deek Foundation to start up, as well as from the Department of Health to print, and then DTL also donated a lot of things pro bono. We did pay them some, but we had very insignificant funding to do this project. So the hope is that we can use this plan to generate some additional funding and then do a 2.0 version where it would be more community-based. I do feel like we need to do that. I think that would be culturally appropriate in Hawaii too. And from a Native Hawaiian perspective, they drilling down at the community level and making sure all voices are included, being very inclusive is very important to the people of the state. And hopefully that will be our next version, and it will have more of those items. So we do recognize that this doesn't take it. I think it's a very good start, and it's very useful, and it's very great, and it's opening up, but hopefully it leads us to the next phase, and that we just keep getting better and better.
I also wanted to add that Kalei Clark is on the call, and he's offered to address that too. And I know we're running out of time. I did also want to say on the Department of Health side with the Under Fives campaign that we are going to be doing a survey of our community and really understanding locally how to create messaging that is going to be received and impactful. Kalei, are you able to speak on this?
Sure. Aloha. I'm Kalei Makali'i Clark. I am one of the folks that ran the data for the safety plan, specifically on Native Hawaiian and Pacific Islanders, which is the community that I belong to. From a data approach side, I will say that we followed the one drop rule. So essentially, anybody that indicates that they are of Hawaiian ethnicity, either alone or in combination with other ethnicities, would be considered Native Hawaiian and Pacific Islander. And this is an attitude that is present here in the Pacific. It does not take into account blood quantum, which is intrinsically a Western approach. In terms of community outreach, you'll see in the plan that there is a very special case study focusing on an organization called Nakamakai. And Nakamakai is based out on the west side of Oahu, which is basically a 40-kilometer span of land that does not contain a pool of any sort. This organization is responsible for the distribution of education, water safety, but also has a cultural vein. And there is an effort for them to build a makeshift pool out on the west side of Oahu. So our plan does highlight that. And I applaud them for all the work that they do, because yes, equity is an issue. I work in equity myself, health equity, and you know, in my recommendations, I do outline the need for further analysis of, you know, acculturation, of language, of pedagogies. How do people learn? So certainly this work is never done, and humility is of utmost importance here. So thank you for your question, because yeah, it is an absolutely good one, and I ask myself the same every day.
Thank you. And I see that we are at the top of the hour here. I have so many more questions that I want to ask you, but perhaps we'll have to do a part 2 at a later date. I just want to, from the steering committee for the U.S. National Water Safety Action Plan, thank you for your time today and for bringing your experience and your best practices to the broader, collective throughout the United States and beyond. It looks like we have some folks from other countries as well, that are wanting to learn from what you've done and replicate your best practices and hear what the challenges were, and try to overcome them as we continue this work throughout the United States. So a special thank you from the steering committee for making this such an engaging office hours here today. And we look forward to continuing to work alongside you all and to learn from what you've done. It's really, really incredible. So thank you.
Thank you so much for having us.
Thank you very much. And just as a quick note, I will pull all of the links that were put into the chat, as well as a link directly to the Hawaii plan, and share that out with all the participants. So you'll receive that by the end of the week as well. All right. Well, thank you all for attending. Very well informed. Appreciate it.
Thank you.
Thanks, Tina.
Aloha.
Aloha.
Tina, I will give you a quick call.
Okay.
Okay. I obviously did not know that was how that. Are you done?
No, there's no way to know.
Recording?
Yeah.
Right.
Oh,
are we still recording, or are we paused?
Hang on. Yeah, but I'll clip it at the end. So.
Okay.